Perimenopause is fraught with these hormonal changes that affect the neurotransmitters and mood. So it's not, it's not a hormonal imbalance that's wrong. It's a hormonal imbalance in perimenopause that is natural. But it's how are our body systems and how are we adapting to that? And in this particular case, how are our neurotransmitters in particular adapting to these normal hormonal changes? I stress that because I'm kind of averse to this concept of hormone imbalance because number one, it doesn't really tell you anything. And in perimenopause, it's normal. And in postmenopause, it's normal. Okay, let's jump into some plants. So St. John's wort in my book is still the number one plant that we should be thinking of for depression. I'm not saying it's the only plant we should be thinking of, but it's always on our list because it has the most research. And the primary use of St. John's wort is in the treatment of depression, not only mild to moderate, but even major depression and even seasonal depression. And then there's, of course, other uses even beyond this list there, but we can use it for many things. But mild to moderate depression in particular is really a critical use of St. John's wort. We used to think that there were some other mechanisms by which St. John's wort worked, but now we're pretty sure that it affects the serotonin reuptake, similar to the SSRIs that are targeting serotonin, maybe even a 50% serotonin reuptake inhibition if you have a certain concentration of hypericin anyway. So that's pretty much how we think it works, but there's likely more than one mechanism, but I still would assert that inhibition of serotonin reuptake is the primary inhibition. Here's a Cochrane review from a few years ago, but nonetheless, it's one that we have. And this was a total of 37 trials, including 26 that compared St. John's wort to placebo and 14 that compared it to standard antidepressants. So those studies all met their inclusion criteria. And there was, of the placebo-controlled trials, there was a lot of variations in the studies. If you looked at the studies that were in patients with major depression, the response ratio for St. John's wort was only slightly better than placebo in 6 large trials, but it was twice as good as placebo in 6 smaller trials. And if you then take out the studies that were restricted to major and include mild to moderate, now we have a 1.71 comparison, and from 5 smaller trials, 6 points comparison. So quite a, significantly more effective than placebo. And the trials comparing St. John's wort, this is what I really love, comparing St. John's wort to standard antidepressants, they were, or whether they were SSRIs or tri or tetracyclic antidepressants, the response ratio was the same as the medication. And there was less dropouts because there was less side effects from St. John's wort. So it was not statistically different between St. John's wort and the SSRIs. So that is really good news. The SSRIs being the most common of the classification of antidepressants used.